Abia state government vows to penalize absentees, primary healthcare workers. The Abia state government has vowed to penalize primary healthcare workers who are absent from their duty posts. Deputy Governor Engineer Ikechukwu Emetu made the declaration at a primary healthcare task force meeting held at the Government House, Umuahia. According to Deputy Governor Emetu, the government will stop the salaries of healthcare workers who fail to report to work. He emphasized that the Otti-led administration is committed to revamping the healthcare system and will not tolerate absenteeism. The government is presently renovating over 200 primary healthcare centers across the state to improve access to quality healthcare. Chief Emetu also condemned traditional birth practice, which he said contribute to high maternal and neonatal mortality rates, and noted that the state government is working towards checkmating their activities. In his speech, Commissioner for Local Government and Chieftaincy Affairs, Chief Prince Uzo Nwachukwu, emphasized the need for collaboration and synergy between state primary healthcare workers and the local government authorities in order to achieve rural sensitization and implementation of health programs. To this end, he stated that the ministry planned to hold meetings with mayors and chairmen of local governments to discuss ways to work together and improve health delivery in rural areas. This collaboration, he added, is expected to enhance the state's effort to improve healthcare outcomes and ensure that citizens have access to quality healthcare services. Earlier in his remark, the Executive Secretary of the Abia State Primary Healthcare Development Agency, Dr. Kalu Kalu, warned that the Inspectorate Division will penalize health workers who are absent from their duty posts, noting that absenteeism undermines the government's effort to revive primary healthcare centers. In their respective contributions, representatives from World Health Organization, Mr. Ephraim Chukwu, UNICEF, Dr. Iwo Hakalo, and John Snow, Incorporated, Dr. Amuzie Chidinma, commended the state government for its commitment to delivering quality health care and emphasized the need for community engagement, timely release of funds, and securing healthcare facilities to ensure workers' safety and effective delivery of immunization packages. The meeting was attended by notable individuals, including Deputy Chief of Staff, Honorable Barrister Chijioke Nwankwo, Chairman Abia Traditional Rulers Council, His Royal Highness Eze Salinus Ntomba, and religious leaders. Thank you for watching. Endeavor to follow us on Kasa TV on YouTube and Facebook for more updates, and endeavor to share this video now. Thank you.
It's no longer news. It's no longer news that health workers in Abia that fails to be present in their workforce, they are fails to attend to their office now will be penalized. You know that what happens before now is that in most of those facilities owned by the government, people who are actually engaged or employed to work, they don't come to office. They don't really come to the office. So it happens that when you employ people to work, they don't come. And one of the reasons why they don't come is that salaries are not actually being paid at that time. So the salary of health workers are not paid. You see people going on strike every day, left and right, including lecturers in schools, tertiary institutions owned by the state government or financed by the state government. They are not actually being paid as when due. So most times people do not come to work for any reason. Including local government staffs and workers, they don't come to work. But the present government is talking about basically the health workers. Under the present administration, we have been able to observe that civil servants in Abia State have been able to earn their salary as at when due. As at today, civil servants can actually plan and say our salary is coming on 28th of the month. 28th of the month, you see your salary. 29th of the month, you see your salary. Even 30th of the month, it's not a situation whereby you may have to go to radio to make an announcement that you are not being paid, or the government have to go to radio to make an announcement that your salary of this month will be paid to you. People will not say, okay, people will not rejoice and say our salary will be paid. So this very time, salaries of health workers are being paid, salary of civil servants are being paid. So the government is saying that it will no longer be business as usual. Where people will now claim, or where people will now hope, we will now believe that salary will be paid when they don't do work. They say that for basically health workers for about 200 primary health centers. You know, the government have been able to renovate and retrofit most of those health workers, and they have been able to fix a lot of things in those health workers primary health centers. Basically, they have been able to innovate most of those structures, make them to be up to standard, which is what people expect the government to do. It's not about who started the structure. It's not about how it was. It's not about who started it. It's not about who built it. It's about what the present government is doing regarding to the health care system. So the present government, led by Governor Alex Shoma Otti, said is under his administration, he will not no longer allow health workers not to come to work again. When they're supposed to come to work, you will not work and you expect salary at the end of the day. So this video is basically to inform the health workers basically, and inform the general public so that let them be aware. So that tomorrow when you hear that this government have sacked 1,000 staffs or 3,000 staff or 5,000 health workers have been suspended or sacked, you will not start asking this government that is not friendly. Also try and know that there was a time this government was able to warn, or there was a time this government was able to create an awareness that is no longer be business as usual. When you are working as a primary health worker, you are supposed to be in your primary center where you are being sent to work and you are paid every month. And then you leave that place and go to the pharmacy or go to an area where you have a shop and you're selling drugs. You leave that place and go to that area where you have shop and you're selling drugs. You leave that place, stay there, and end of the month you expect the government to pay you, and the government will still pay you, and you do it every time. Before now it has been happening most times. Not all health workers, but most of the health workers, most of them, not just the health workers alone, civil servants as a whole in Abia. So at that time, even in 1 year, you hear that they only pay them 3 times or 6 times highest in a year. So the remaining 6 months, no salary. What happens to them? Most of them have family members too. So we can say reason why it was happening that time was because basically because the government was not paying salary. But today the government is paying salary as at when due. So it is now left for the civil servant right now. It's now left for the health workers right now to ensure that they come to work as at when due. So just make sure you share this video. Make sure you share. You may have a civil servant that maybe may not be in your family, but maybe in your contact list. So make sure you copy make sure you copy the link of this video and send to someone. Send it to different WhatsApp groups. Send it to different groups so that they can also be aware of the new trend in Abia. That civil servants now may have to work. Will now have to work for them to earn their salary. When you don't work, when you're not in office when you're supposed to be, and you do that continuously, know that there is now vacancy in your job, and they may actually sack you anytime from now. Share this video, copy the link of this video, send to someone, share this video, drop a comment, let us know what you think about it. Don't forget to follow Casa TV on Facebook and YouTube. Thank you.